Tuesday. I hope you all had a really great Memorial Day holiday. I know it was good to have some sunshine and a little extra time at home. I just was reminded when I took this mask off that I saw lots of people this weekend either not wearing a mask or wearing it incorrectly. So let me remind everyone how to wear a protective face covering. Again, it can be almost anything made out of cloth, but you want to make sure it goes over your nose and below your chin. Right? This is the way that I will protect other people from getting the germs that I might be carrying. So I protect you, and then when you wear your mask properly, you protect me. So thank you for doing that, and please, participate in protecting the health of our community by wearing your mask. Under like this, your chin is not the way to get it done. Okay. Back to COVID-19 and a few of our numbers. You might have noticed if you have been looking, this week we have made some changes to our report and the frequency of our report. I should say reports. Before today, we were, before Friday and before, this changed over the weekend, we had 2 reports that went out each day. One was a dashboard, a COVID dashboard that it contained data globally in the US and Alabama, and then also had some factoids or information or links to really good articles or quotes from our health officer. And we will no longer be providing that document, and instead providing our daily patient characteristics report. It has changed somewhat as well, and beginning today it will only be provided on weekdays. So Monday through through the rest of this week, and then next week starting Monday through Friday. So just to update you, worldwide there have been 5.5 million cases of COVID-19 disease with 350,000 deaths worldwide. And in the United States there are more than 1.7 million cases of COVID-19 with about 98,000 deaths. These are really staggering numbers, and it just really shocks me when I drive down the road and see people congregating and out in close proximity and not wearing that protective facial covering. The Alabama dashboard at alabamapublichealth.gov beginning this week will be updated once daily in the morning. They're reporting 15,311 cases of COVID-19 in the state of Alabama, with 1,659 deaths. That's around 11%, which is very close to it's exactly the same as the number of, did I say deaths? I think I did say deaths. Let me correct that. Thank you. 1,659 hospitalizations, sorry. That's 11% of the reported cases hospitalized. And for deaths statewide, it's 573. That's 3.7% statewide, which is a bit below what we see in Mobile County. So in Mobile, this morning, our daily report, we are reporting on 2,043 patients with COVID disease. 225 of those, or 11%, hospitalized, and 111, 5.4%, slightly higher than the statewide average, or the statewide proportion, have died with COVID disease. Yesterday, we added only 31 cases of COVID, 3 with hospitalization, and 0 additional deaths. But I want to point out that last week, Mobile County had the highest number of COVID-19 cases reported to us than any other week since the outbreak began in mid-March. So we thought we were starting to stabilize a little bit, maybe drop a little bit, but instead last week we saw the largest number of cases, just by a few, but just want to point that out. Still, about 15% of our cases are healthcare workers, about 15% residents of long-term care facility, and 8% employees of long-term care facility. So we know that healthcare workers and outbreaks in congregate settings are really contributing, or have been contributing to our numbers. We hope to tease that out a little bit more over the next week or so and see if we can't provide some additional insights into the pattern of community transmission as compared with transmission in congregate settings. A new calculation for us and for the state of Alabama, you'll see that they have added presumed recovered to the dashboard that ADPH puts out. I think that will be published once a week. And let me be very patient with me as I read this definition. It's very tricky. So a patient is presumed recovered if it's been 14 days or more since they tested positive if they were not hospitalized, or if it's been 32 days or more since they tested positive if they were hospitalized, or if hospitalization is unknown or missing. And of course, anyone who died with COVID is removed from this calculation. So when I sharpened my pencil and got down to trying to figure this out over the weekend, from my first calculation, 53% of all of the COVID-19 cases reported in Mobile to date are presumed recovered. So 53%, around 1,071, I calculated this yesterday, patients were presumed recovered. So that's good news and new information that we are sharing publicly. I hope that it'll be a little bit more automated in calculating that, which is less prone to errors, as we know. Going forward, we will try to provide that data point to you weekly. So hospitalized, again, we had 225 and then 111 who have died. So here's a little bit more information on those. Among COVID patients with known hospitalization, around 38% required intensive care and 21% required mechanical ventilation. We know each of these are indicator of severe outcomes in COVID-19 patients. And again, just to remind you, 90% of the people who are hospitalized are 50 or older. 95 patients who died were in a hospital and 16 were in long-term care facilities when they died. And just a note that COVID transmission in long-term care facilities accounts for more than half of all deaths in Mobile County residents. So important to acknowledge and sort of try to tease out the effect that these outbreaks are having on our overall trends of diseases and cases. And again, when we look at, we're now plotting the number of cases reported weekly by report date. So you can see that we had almost 300 cases reported last week. And then today is the first day of the week that we update and publish the new map that is done by our GIS professionals down at the City of Mobile. So they had to add a couple of more categories, so they changed the color. So take a look at that, where you can see more detail about what's going on the eastern side of our county in the City of Mobile with that new help with the maps. So that is what I have to say about that today. So again, keep up your guard. We are nowhere out of this mess yet, and we still don't know if we have reached our peak. Certainly it doesn't look like it. I thought maybe we had, but then perhaps due to some movement restrictions being listed, we saw the number of cases go up. Some information that I want to share to you that has changed. You know, we are always talking about how quickly the guidelines of the U.S. Centers for Disease Control change, and then our need to rapidly try to change and adapt. So yesterday, or last week rather, they published this rather lengthy, 50+ page document on case investigation and contact tracing, and it's has recommendations for doing a lot that we are not capable of doing right now. So our agency is trying to digest this and decide where we can flex to do even more with case investigation and contact tracing using the staff that we have currently available to us. So you may see some changes coming on that. For example, previously CDC was recommending quarantine for all contacts of laboratory positive COVID patients, and that is still a recommendation, quarantine and symptom monitoring. But now CDC is saying that we should be calling these folks every day and that we should be testing all of the contacts with PCR tests. And that's an enormous effort for any health department. And it's really gauged at trying to conduct case findings so that we can identify a case and quickly identify all of their contacts to try to slow the secondary and tertiary and quaternary spread or transmission of the virus. We know from our contact tracing that's being done by some of our inspection team that about 25% of the contacts, when we reach them after having been identified as a contact, about 25% of them are already PCR positive. So it is real, folks. If you're exposed to a laboratory confirmed COVID case and you were within their proximity for 15 minutes or more within 6 feet, you were exposed to COVID and have a large, a big risk of getting infected. Particularly, we are worried about those who are in that exposure category who are vulnerable to severe complications. So people that are 50 and older or anyone who has an underlying medical condition. All right, a little more about the Safer at Home order that went into effect on May 22nd, just a few days ago, even though the holiday seems like put a mile between us and when this Safer at Home order went into effect. And again, it ends on July 3rd at 5 p.m. So this is the amended Safer at Home order. And I'm just going to quickly go through some of the new updates that went into effect or that were in the amended order that came out on the 22nd. So entertainment venues such as arcades, theaters, and bowling alleys are open, subject to social distancing and sanitation rules and guidelines. I'm going to start calling that social and sanitation rules. Athletic activities, so practice is allowed beginning May 23rd. Competition is allowed on June 15th, all subject to social and sanitation. Educational institutions can open on June 1, subject to social distancing and sanitation guidelines. Child care facilities are open, subject to social distancing and sanitation rules. Summer camps open, subject to social distancing and sanitation rules and guidelines. And then we still have a long list of things here that stayed the same in the order, that you're encouraged to stay at home, that businesses may open subject to sanitation and social distancing, retail stores can open at 50% occupancy, medical procedures are allowed unless prohibited in the future to preserve resources. Regular programming at senior citizen centers is still suspended, except meals should still be made available through curbside and pickup or delivery. Hospitals and nursing homes still must implement restrictions to visitation. All non-work gatherings required to maintain 6 foot of distance. Restaurant, bars, and breweries may open with limited seating, 6 feet between tables and subject to sanitation guidelines. Athletic facilities may open subject to social distancing and sanitation guidelines. Close contact service providers such as barbershops, hair salons, nail salons, and tattoo parlors may open subject to the social distancing and sanitation guidelines. Beaches open with no limit on gatherings, but you must maintain 6 feet of separation. I did not see a lot of that happening over the weekend. All right, on to some questions. One of the things that came up, I saw a couple of folks last week on Friday. I was with the Centers for Disease Control and the Alabama Department of Public Health conducting a site visit at one of the long-term care facilities that has had a coronavirus outbreak. And Friday morning and the afternoon, I was out of work conducting that site visit, so I have a great appreciation for Dr. Laura Cepeda, who our Chief Medical Officer, who stood in my place. And I believe we also had someone from WIC who spoke on Friday. So thanks to those two coworkers for standing in to answer some important questions. So I will try to answer your questions since I'm back in the office today. Has the health department traced any positive COVID to businesses that reopened while defying the governor's order? – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – –– – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – – –– – – – – – – – – – – – – – – – – – – – – –– A question about the fact that Jefferson County's health officer extended restrictions on entertainment venues that would have otherwise been lifted by the governor. And the question was, MCHD has the same, the health officer, Dr. Bert Eichel at the health department, has the same authority to, take more aggressive action than the state health officer. And this person of the media was wondering if we were going to follow suit like Jefferson County and extending restrictions on entertainment venues. And the quote from Dr. Eichel is, "We will watch data and discuss with the unified command." As you know, it's the health officer, the governor, the mayors, and the county commissioners that are making those decisions together. Here's a question about the number of cases on the rise over the weekend, a one-day rise of 639 cases statewide. The positive return on test is holding steady. Is this an indication that policies and guidance at the safer at home order is effective because the prevalence of the virus doesn't seem to be rising? So that's what we had hoped before the end of last week, that maybe the somewhat leveling and perhaps slightly downward trend of positive cases may have been a good sign that the safe at home order was being affected. But I think in the last days of the stay at home order, and then more movement under the safer at home order, I fear that we are going to see transmission rise again. So stay tuned for that. Is there any data that suggests a deceased individual can pass on the virus? The answer to this is no. A person who may have attended a visitation at a funeral home that since tested positive could have been exposed before the funeral and may have been exposed at the funeral. There may have been family members who were exposed prior to their family member's death that could have been infectious, and if they were not adhering to those 6 feet guidelines, it's very likely that person-to-person transmission may have occurred at that gathering. We've really cautioned, particularly religious events, churches, funeral homes, funerals, choir practices, those sorts of things. We know in these closed settings where there are people who are not respecting that 6 foot distance, we know when there is someone who's in the room who is transmitting virus, they can infect a large number of people. So that person would not have gotten infection from the decedent, but more likely a person at that social gather or religious gathering, or maybe in the community. Why has MCHD stopped reporting the actual numbers associated with facilities? So this is a situation where nothing I do pleases everyone. So we had some people sort of saying, there are too many numbers in the report, please feed it to us in a way that we can understand it a little bit more easily. And now we have a couple of people saying, recognizing that today I took the number out of the report and just put in the percentage. So if you'd like to know the number, you can get an approximate number by multiplying the total number of cases by the percentage. But I will consider as we go forward that there are people on both sides of the coin that want to see the actual number and then like to see things in a sound bite or an infographic that can be understood more easily and quickly rather than having to read the detailed report. So again, can't do anything, can't please everybody. All right, here are some things from Facebook asking me to explain the other or unknown category and what that includes in the demographics section for confirmed cases in the daily update sheets. So here's what happens. I think I wrote this. Let me see. Okay. Interviews of patients with COVID-19 disease are conducted after a PCR positive laboratory result is received. Obtaining complete information on patients is a challenge for investigators, and data may be incomplete. So you know about a positive test as soon as I know about it. And by when the time I know, then I start my investigation. It may take me a day to pick up the laboratory result. If the lab result doesn't have a telephone number of the patient, I may have to call the lab or call the provider to try to get the patient's telephone number. If the patient's telephone number is not available by the lab or their provider, or they have a bad number, then I have to contact one of my coworkers who has a White Pages account, not White Pages, but something very similar to it, to see if we can find a good telephone number or address in administrative databases. So by the time all of this has happened, it takes sometimes a couple of days for us to get a good telephone number, and then we have to find the person at a good time that is convenient for them to conduct a lengthy interview, and then I do my data entry, then I start calling all the contacts. So I wish that we got all of the information that we need from the individual at the same time as we receive their positive lab report, but that is not what happens. And that is why you see a large number of unknown or missing. Also, we are now just not able to contact about 25% of our COVID-19 positive laboratory patients. So there is some level of data that will always be unknown. Sometimes we're not able to interview the patient, like when it's someone who is hospitalized or who has died, and we have to rely on a proxy to complete that interview. That also sometimes results in incomplete or unknown information. So it's not a very clean or exact science. So thank you for your patience on that and that question. I hope that helps some folks understand. Are you still unable to get specific numbers of COVID patients at the hospitals? So there are two ways that we get information, specific information on hospitals. One is through the Alabama Information Management System. I think that's what it stands for, AIMS, where the hospitals are reporting 3 times a day how many COVID patients they have in their hospital at that time, how many beds, how many ICU beds, how many ventilators, how much PPE they have, just this metric that folks in our emergency preparedness department look at on a regular basis to know if we need to move more ventilators into Mobile County, for example, or if we need, if hospitals are on diversion because they're low on ICU beds and we need to take patients elsewhere. So that information is available to public health, hospitals, and emergency managers only. And then the other way we find out about hospital numbers is the COVID laboratory result usually contains the ordering provider. So we will know if that test was ordered or conducted at one of the hospitals nearby. And we know, if they're hospitalized, most of them we know what hospital they're at. But we don't report that information specific to each hospital because they could do that if they wanted to, but we don't report that information. The same way in which we don't report if a fast food chain has positive cases or if a daycare or a school has positive cases, unless there is an overwhelming public health need for doing so, like we're not sure how we would be able to identify people who were exposed, except that by saying a specific place at a specific time on a specific day, had COVID and you may have been exposed, so stay at home. Who do I contact about the establishment not following a safer at home rule? You can contact the Attorney General's office in Montgomery, or you can contact local law enforcement. Those safer at home are emergency rules, and law enforcement can issue a misdemeanor and a fine for that establishment. Oh yeah, here Mark wrote it for me. Call 911 as local law enforcement has been tasked with backing the governor's health order. All right. Here is someone asked, say we just have a couple minutes left. Let's see, this goes on for a little time. Let me jump down to this question and I may go back. Someone has been asking me, and I've answered this several times, about Mardi Gras organizations who are continuing to have meetings, planning meetings for their Mardi Gras activities, And, you know, what does the state's health order say about that? And the state's health order is very clear. I understand that people don't want to read it because they don't want to they don't want to close or cancel their event. So they write to me and say, "Hey, can you answer this question?" But it's right here, right? Gatherings that do not allow for 6-foot physical distance from people outside your immediate household are prohibited from doing so. No gatherings are permitted under the amended Safer at Home order that do not allow for 6 foot of physical distance between members of different households. And someone that you've grown up with for 50 years in your secret society is not a member of your household. It is your wife, intimate partner, child, or adult parent is in your household. So no, Mardi Gras meetings or any meetings that cannot facilitate 6 foot physical distance are prohibited under the amended Safer at Home order and are punishable by a misdemeanor offense if enforced by law enforcement. And actually, some of these mystic societies, I know they have a lot of really young, healthy people who, if they got exposed to coronavirus, they would survive the illness just fine. But you also have a lot of members who are over 50 or who have underlying medical conditions. So do not risk having an outbreak in your mass gathering because you could not facilitate the 6 feet of physical distance and potentially take out or create severe complications, hospitalization, and maybe even deaths in your orders. So with that, I'm going to don my mask and we will talk to you Thursday at 2:30 because again, most Wednesdays, the Unified Command holds a press conference with the mayor of Mobile, the county commissioner, and our Mobile County Health Officer, Dr. Bert Eichel. So thank you, and we'll talk to you on Thursday.